So why would you take that for a different diagnosis?
Well, a lot of people have pain during their period. Your garden variety period cramps is what usually is going on. But, of course, the hidden diagnosis is endometriosis. And endometriosis is a relatively common condition in which the glands that normally line the inside of the uterus get outside the uterus into other parts of the body, the tubes, the ovaries, the lining of the pelvis, even the bowel or the bladder. And women that have endometriosis, they don't have garden variety cramps. They have, crawl into fetal position and whole bottle of Advil kind of cramps. And this is really, really painful stuff.
So I have a little animation I want to show you all that I think will help you understand why, with endometriosis, you get all those symptoms that Dr. Stryker spoke of. So normally, when you're having your menstruational period, you'll have material on the inside of the uterus, and it builds up, as you know, during the month. And as it's supposed to be evacuated, instead of coming out from down below like it's supposed to, some of it regurgitates back through the fallopian tube and drips out, initially on top of the ovaries. But as you can spread, these little satellites go all over the place. They lie on top of the uterus, on top of the fallopian tube. They can sit down on the bladder. They can attach anywhere in the abdomen, way away from where they came out initially and touched the ovary. That's why it can present in so many different ways. And it's an atypical pain, but of course it gets worse during menstruation because that's when the body thinks you're evacuating it out the normal route. So Dr. Stryker, how can you help your doctor identify when it's not just a garden variety menstrual cramp?
Well, there are a couple of clues you need to tell your doctor that will get them to that diagnosis. One is when you're telling your doctor about your cramps, you need to emphasize that they're getting worse and worse and worse, because that's what happens with endometriosis. The medical word for cramps is dysmenorrhea, and it's what we call progressive dysmenorrhea. It just starts off not too bad as a teenager, and it gets really bad. The other clue is that even someone who has the worst cramps, when your period is over, it's gone. It's over. Women with endometriosis can continue to have pelvic pain in between their periods because of scar tissue. They can have pain with intercourse. They can even have pain with bowel movements.